Today, on Your Health Matters, we are discussing the prevalent myth about dementia in Black individuals. Welcome. I'm your host, Dr. Muthoni Kariuki. To begin with, we start by defining dementia, which according to the NHS is described as a group of related symptoms associated with an ongoing decline of brain functioning. Now, on to symptoms of dementia, still from the NHS website. Now, if you've worked in a care setting or ever taken care of or come across someone who has dementia, some of these symptoms are familiar. For example, memory loss. You'll find that over time, someone forgets or may forget their entire life. They may forget when they were born, their parents, their children. In fact, some of the people I've taken care of who had dementia, they may think that their children are strangers. And also they may forget about the jobs they've done, their families, and things that are basically important to them. Other symptoms of dementia include understanding, judgment, mood, movement, and difficulties in doing activities of daily living. In understanding, you may tell someone who has dementia, what you did yesterday, maybe hitting someone, attacking someone was not good, and they'll have forgotten about it 2 seconds later. Or when it comes to difficulties in doing activities of daily living, you'll find that something as simple as washing their clothes, you'll find they're taking their clothes and putting them in the oven as opposed to the washing machine, something that they've done 1,000,000 times before. So, what is the number one myth about dementia in Black communities? This is that dementia does not affect Black people. In fact, some people believe that dementia is a white man's disease, but this is not the case. Dementia does adversely affect Black people or people of Black origin. In fact, around 2.13 million people in sub-Saharan Africa were living with dementia in 2015. And then among older individuals aged 65 years and over, that is African Americans, they have the highest prevalence of Alzheimer's and related dementias, and that was in 2018. And then around 1.3 people living with dementia in the UK are from Black, Asian, and other minority groups. That is around 25,000. And this number is expected to increase, more so with the increasing proportion of older individuals in the Black community. Next, we look at some of the challenges faced by the Black community in terms of dementia. Number one, there's a general lack of awareness of dementia among the vast Black communities. In fact, dementia is often mistaken for old age memory loss. And that would mean that individuals who have dementia, they would be diagnosed much later as they're supposed to, and they would miss out on some key treatments and support. Secondly, Black and other minority groups often face delays in dementia diagnosis and barriers in accessing services. And this would be due to lack of awareness as well as systematic racism or racial bias when it comes to the medical services. And then thirdly, lack of culturally appropriate dementia services. There lacks culturally appropriate treatments, services, and support for culturally diverse older individuals. In my experience as an activities coordinator in a care home, all of the activities are geared towards older individuals who can best be described as white British. That means as a Black person, there'd be nothing to help me cope with my dementia or improve my symptoms. Number 4, there exists little research on dementia and its impact on the vast Black communities. And unfortunately, this is both home and abroad. So in our home countries, there's literally no research when it comes to dementia and how it is affecting older individuals and what we can do to make life better for their families and for these individuals. And then when it comes to developed countries where some older Black individuals are living, there also lacks the research that would help them find appropriate treatment and support. So the little research plus lack of awareness and increased number of dementia cases means in future the Black community will overwhelmingly face negative consequences when it comes to dementia. So it is time for action, and I think it's important we start by creating awareness. So do you know anyone who has dementia? A family member, a friend, a relative? What were your experiences? Did you receive any support? Was diagnosing dementia easy? What are the challenges that you have faced? Thank you for watching this episode. Please let us know if you have any questions about dementia or about any other episodes that we have posted. Please subscribe to our channel, share, like, comment. Thank you, and see you next time. I've been your host, Dr. Modoni Kariuki.